last Friday we performed a very interesting case actually. Let's go to the drawing board. I posted a video, what exactly is plantar fasciitis? I hope everyone took a look at that video, even though it was a little bit on the lengthy side. Plantar fasciitis, plantar fasciosis, heel spur syndrome, in Spanish, el espolón. Okay. This patient had been battling heel pain for many, how long? 10 years. Sorry about that. 10 years. 10 years. To put things into perspective, I'm 41. 31 to 41. Can you imagine? Like I said in that previous video, any type of heel pain, whether it's Achilles tendonitis, anything, in this particular case, plantar fasciitis, plantar fasciosis, you need to be aggressive. You need to be aggressive because it's the only way that we can get patients better, especially when we're using our heel and our foot every single day. In this particular patient, we decided to go full Monty. Number one, plantar fasciotomy. Number two, PRP. Number three, ozone. This is a Z. And number four, we'll just say, what?
Great penmanship.
The best. A percutaneous microtenotomy, also known as, we'll just say dry needling. 1, 2, 3, 4. We started with a plantar fasciotomy. We released that ligament. We went to number 2. We infiltrated the PRP. Then we took about 3 cc's of ozone gas and injected it into the affected area. And last but not least, we ended up with the dry needling procedure. So let's take a look. This is 3 days after. Okay. Usually there's one stitch, but we decided to, even though we really didn't have to, we decided to extend the incision just a little bit more here. So there's 2 sutures. As everyone can see, everything's very clean. No edema, no swelling, no bruising, very tiny, maybe here, a little bit minimal. The patient doesn't have any pain today, okay, which really doesn't mean a whole lot, right? That's a good sign, but it doesn't mean a whole lot because I've seen cases where even though in the acute phase, you, because of the inflammation, sometimes there isn't any discomfort whatsoever in the first couple of days. The patient was also complaining of discomfort in this area, right? And we performed the micro needling in this area here, okay? And also here as well. As everyone can see, maybe you guys can see these tiny little dots here. But basically what we do is we fenestrate in this case, the plantar fascia. And the reason why we do that is to basically just attract, right, more blood to the area, more important cells, more to convince the brain into please send that anti-inflammatory cascade down to the affected area to heal this problem that the patient has been battling for 10 years. So, you know, this is a fantastic procedures for a very chronic case of chronic plantar fasciosis. In a case as such, we decided to get an MRI to make sure that there wasn't a partial tear of the ligament. That would change the entire treatment protocol, and that wasn't the case. The MRI revealed thickening and a lot of edema and also degeneration of the ligament. So I think this is a very good case. I think we did try, the truth is we tried the GoPro and it was a total, utter disaster. I mean, it just was. So we're gonna, the next time I do it again, another plantar fasciotomy, I'll make sure that we can definitely get that nice, view so that everyone can really see what I'm seeing. Like always, www.jospodiatry.com, Facebook, Jos Podiatry, Instagram, Dr. Tojam, and YouTube for all of our YouTube.